Shall I start?
Yes, we can start.
So, good afternoon, everyone. I'm Dr. Kirti Sota. I welcome you all to FB Live session from Dr. Makkar's Diabetes and Obesity Center with yet another very interesting topic. As we all know, that when a person is diagnosed with diabetes, there is a good chance that he or she has to take medication or insulin along with diet and lifestyle management. And what we have noticed is that many times medicine is not taken as prescribed, which may be because of so many reasons like lack of clear understanding about when and how to take medicine, lack of clear understanding about the importance of time of medication. But there is a very, very big question: is timing of medicine really so important? So let's try to find out the answers from Dr. Makkar. Welcome, sir.
Thank you, Dr. Kirti. Good afternoon, everyone.
So, sir, my first question to you for the day is timing of medicine really so important in terms of glucose control?
Yes, of course. This is one area which often gets neglected when patient is being prescribed medications for diabetes management, especially specifically for glucose management. Or, even if patients are told, they don't consider it so important, so they, at times change the timing of medication and take the medications at their whims and fancies. But timing of medication in relation to food, especially for diabetes control and even for blood pressure control, there are important aspects that need to be kept in mind. So every medication should be taken as per the recommendation of physician in relation to the food.
So, what will happen, sir, if we don't take the medicine in time as prescribed?
So for this, I think I'll take a little time to explain, this in detail. What happens is, uh, in a normal individual, the glucose, blood glucose levels remain in a very narrow range of 70 to 140. So when the person is fasting, person is, during night, midnight, uh, or patient has not taken meal for say 6 hours or 8 hours, the blood sugar will be at the lowest levels. But they always remain above 70 usually. And once person eats, there is a sharp increase in glucose level, which usually remains less than 140. And this is the ideal range that we try to target for all our diabetes patients. Now, this may not be feasible, and that is why a more practical approach is taken for most of the patients, keeping a fasting range between 70 to 80 on the lower side and up to 130 on the upper side, and a post meal range of definitely less than 180, but preferably less than 140 or 160. Now, to keep this in range, there are multiple hormones in body which are active, and insulin is the predominant hormone which controls the glucose levels in normal range. What happens is once person takes food, so even before the food reaches the stomach or digestion area, there is changes in the hormone levels which are happening to improve the utilization of this food. And that is why once the food is absorbed from stomach after digestion, whatever food we take, whether it is carbohydrates, fats, or protein, ultimately the energy gets, you can say that fuel gets converted into glucose. Glucose is the primary fuel which is utilized by various tissues for their functioning. That is the primary or petrol for all the body cells and tissues. Now, whatever food we take, it will directly, indirectly get utilized as glucose, and if not glucose is not available, or some tissues will be selectively using some fat also. Now we are here more concerned about glucose. Now in a diabetes patient, this system, the absorption of food will happen normally, the glucose production will happen normally or maybe increased, but to utilize this, the insulin, which is the predominant hormone, is not getting secreted in response to the food, or the early hormone changes that happen. to digest and utilize this glucose level and keep it in normal, those changes are delayed. So what we are doing is we are giving medications from outside or insulin from outside to make sure that in response to meal, the glucose level don't go up beyond a certain range. Now, normal individual, everything is working like a computerized system. There is a slight increase in glucose, there is a parallel increase in hormone or insulin, it is utilized. The glucose starts going down during fasting phase, the glucagon level will go up, it will bring up the glucose level. So it will keep it in narrow range. But in a diabetes patient, this computerized system is not working. So we are giving everything from outside. Now, normally the glucose rise happens in response to meal between 45 minutes or so. It starts increasing around 30 to 45 minutes. And actually, the small increase may happen, say, within 10 minutes or so. But the rise majorly will happen between 30 to 45 minutes. The glucose will peak at around 2 hours, 1.5 to 2 hours. And then as it is utilized, there will be decline in glucose level before next meal. So by the end of 3.5 hours or 4 hours, the glucose levels have come down to basal level. This is the normal. Now to bring down this, if we are giving insulin from outside or we are giving medication from outside, we have to time it in a manner that it starts acting by 30 minutes or so. And its action also peaks around 2 hours when there is maximum need for medication to bring down glucose. And as the glucose goes down, it affects also either declines or matches with the next peak of the next meal, right? So now if we have given a medication, say just before meal, and this medication will take 45 minutes to initiate its effect. So what will happen? The effect will happen, say, start happening around 45 minutes or 50 minutes later, while the glucose is already rising at a good speed. And maybe the peak will happen at 3 hours or 4 hours, which is the time when glucose is declining. So actually person may, well, one, the glucose will not be controlled. Now, since the medication effect is maximum when the glucose level is already declining, patient can go into low levels or hypoglycemia. But if we are giving the medication, say the medication is required to be given, say 45 minutes before or 30 minutes before the meal to get absorbed so that it starts acting, slowly by the time person is taking meal, and that action is going up and also peaks around 2 hours and comes back again with the meal, then it will give a much better control of glucose. So this also varies with every single medication. There are medications which are given in morning will have a sustained effect 24 hours. They will act only if the glucose levels are high. They will not act if the glucose levels are low. There are medications they will act irrespective of the glucose levels, and if the low levels are low, they will push it down. Similarly, there are different insulin. So matching of the timing of medication with meal is very, very important.
So now, this is we people actually what we people do is we create a confusion for the patients. We use a variety of terms: empty stomach, pre-meal, after meal, with food. So I want you to clear all these terms today. Like, let's talk of what do you mean by a medicine which has to be taken empty stomach. Empty stomach
so empty stomach means empty stomach. That means you have not taken anything except for some
Fine.
water. Some
Okay.
water.
And
Now,
if
with the newer medication, even that also has to be kept in mind. If you have consumed, say, 1 full glass of water or 2 glasses of water, maybe you will better not take the medication for another 30-45 minutes. Right? So empty stomach is actually empty stomach when you have not taken anything. So something like thyroid medication,
yes,
thyroid hormone is best given empty stomach. There are medications which the absorption of which is interfered with the presence of food or changes in the stomach pH level, or medications changing pH level. So we have to make sure that we are giving them away from food intake, or we are not combining those two medications at one particular time.
So we prescribe patient the medicine has to be taken half an hour prior to the meal. So what do you mean by this half an hour? Is it before tea or before the breakfast?
So usually when we say before breakfast, there is usually confusion. The people think that tea is also part of. So morning tea, if they are taking morning tea and they are taking just one biscuit or one usual North India, there is something called that rus, and everybody takes that rus or one biscuit or two Mary biscuits. Usually diabetes patients take with a cup of tea in the morning. So that morning tea is not the time for your medication, because if you are giving a gap, say, and normally, what we see is there is a big gap between the morning tea and breakfast. Usually there is a gap of 1.5 to 2 hours, right? So in my own case, I have my morning tea, then go for break, walk, come back, have another glass of Nimbu Pani, then I will get ready, then have breakfast. So what 1.5 to 2 hours gap. Now, suppose they take medication before morning tea. Now they have not taken sufficient calories. Normally, a breakfast will have about 350 to 400 calories. What they have taken is about 30 calories with a cup of tea, or 20 calories, and another 20-30 calories with the biscuit or food, maybe max 100 calories. Now they have taken medication which is supposed to neutralize or bring down the glucose rise by 400 calories. And suppose this person is going out for a walk. So very likely in 1 hour time, this person will start getting low sugar levels. And during walk, the person can get into hypoglycemia because he is already utilizing more calories because of his walk. So medication before breakfast means before breakfast. That means when you are having your breakfast, you take it, say, 30 minutes before breakfast. Or if it is to be taken just before breakfast, that means you take it just before breakfast. Right? There are medications which can be taken with meal, during the meal, after the meal. It doesn't matter. But if it is to be taken half an hour before breakfast, then if you change the timing, say you bring it closer to just before meal, you will mismatch the impact of drug levels with the glucose levels, and very likely you will have a disturbance there. If you take it, say, instead of 30 minutes, you think that I have to rush, I will take medication, quickly go out, do some work, come back and have breakfast. And you have given a gap of 1 hour. So the medication is already acting and you have not taken meal. So again, you can get into hypoglycemia. So if you don't time these medications properly, they can give you sharp swings of the glucose levels, resulting in hyperglycemia or hypoglycemia, both.
So one more thing is we advise patients for few drugs, it has to be taken with food. So what do you mean by with food?
So, with food is that means you can take your pill and start eating, or you finish your food immediately after food you can take. People take in the middle of food,
Yes.
doesn't make much difference. Just before food, with food, after food, that means it is not going to change much. Now, there are some medications which, if given empty stomach or before meals, are more prone to cause gastric upset or gastritis. So those medications preferably are given after meal, so that their impact on gastric irritation or stomach irritation is minimized and the person does not have problem.
So my next question will be about this medication which we are talking about. Okay, whether it has to be taken just after the meal or there has to be a gap after the meal
So
and
you
the time
can
of
take,
medication.
see, if you take it just after the meal, these are slow release medications, mostly what we did. Or even if they are, getting dissolved immediately, their absorption is not interfered by food. So best is to take, say, maybe 15 to 30 minutes after meal, because by that time your stomach is already, you already have food and there are less chances of gastritis. But you can take it immediately after meal also, say within half an hour or so.
So, sir, we got the answer that we have to take the medication as prescribed by the physician. But now let's come to the topic of insulin. Let's talk about insulin. When should I take my insulin?
So again, it depends on, uh, we discussed about the gaps before the meal. There are some medications which start acting almost immediately after intake, right? And there are some medications which have to be present in stomach when person is eating to have their food impact. There are some medications which you consume just before the meal will cut down the glucose absorption from your food. So if you have taken them say 1 hour before meal and the drug has already gone into stomach and gone further down, it is not going to cause any effect. So that is why some medication will need to be taken with meal just before meal so that once the person is eating, the medication is already there in stomach. There are some medications we get absorbed like flash. So they again have to be taken just before the meal. Similarly, insulins also depending on the time of action, how much time they uh, take to initiate their action, which type of insulin, at what time does the effect of that insulin peak, and how much time the effect lasts. These are the deciding factors for how much timing should be, how much should be the gap or the closeness of the timing of insulin administration with the meal, or can it be given just irrespective of the meal, right? So there are rapid acting insulins. Now we have ultra rapid acting insulins, which have their effect within 4 to 8 minutes, right? So they have to be taken just before meal. And if you have advantages, if you have forgotten to take your dose, you can take it during meal also because the effect is almost immediate, right? And there is a sharp peak and sharp decline. The conventional insulins, like the commonly used ones, Act Rapid, Mixtard, human insulin 3070. There are so many 3070 insulins, the conventional insulins, not the analog insulin. These insulins have a time to onset of action is about 30 to 45 minutes. So they need to be taken at least half an hour before the meal so that the effect matches with the glucose rise which is happening in response to meal. The ultra rapid I mentioned, they are to be taken just before meal. Then there are basal insulins like Lantus commonly used, or Basalog commonly used, or Tresiba commonly used. Uh, so these insulins, they give you a constant effect on glucose level over 24 hours. So they can be given irrespective of the meal. All you need to do is to make sure that you are giving the dose every 24 hours, plus minus say 1 hour. You don't need to be sitting with the clock all the time. So suppose somebody takes it say after taking bath, and that is the standard time, is usual bath time doesn't change much. You don't need to remember time. So once person has taken is good for 24 hours. Now this person, whether is taking meal immediately or missing his meal or taking after 6 hours, it does not matter with the insulin. But other insulin, the rapid acting or regular acting insulins, the timing is very important. So it depends on what insulin we are prescribing or what insulin somebody is taking, and that decides how much important is the timing in relation to insulin.
So, sir, we always say you should know your food. So, like that only, you should know your medicine also.
Yes.
To a little extent. So my next query to you is, people always come and talk to us about कि खाली पे डॉक्टर साहब मैं दवाई लूंगा तो कोई side effects तो नहीं होंगे. So how do you take it?
That is a very common apprehension that if you're taking medication empty stomach, it may cause side effects. Usually, the common side effect that we see is the gastric upset. That's the only thing we see most of the time, or some nausea. Otherwise, it has nothing to do. In fact, there will be some medications which are absorbed, as we have already discussed, which are better off when they are given empty stomach. There are other medications which are better off when they are given after meals. Now you have to give something for gastric upset. Best is to give it early in the morning because most of the time gastric upset will happen in response to meal, right? But if you are combining that antacid medication with thyroid medication, it will change the effect of thyroid medication also. So you will have to keep a gap between them. So you should always time your medication very clearly, understand how it is going to change other things, or just keep in mind, if your doctor has told that this is to be taken in this particular manner, then please follow that, because there is a reason why a medication is being given to you, say once daily or twice daily, before meals or after meals or with meals, your insulin dosing time, all these things, when you get add on, qualifying instructions, they are very important to be followed, because otherwise the impact of or benefit of drug that you should be getting, you may be missing.
So now, few other questions which I would like you to answer them is, we always come across query ki, Doctor Sahab, what will happen if I take my medicine and miss my meal?
So in diabetes, certainly it is very important to make sure that you take meal, because whatever medication we are giving to you is on the presumption that you are going to have an increase in glucose level in response to the meal. And that is why your medication is usually given before meal, so that once the glucose is rising, the medication will cut off the rise of glucose and keep it in the normal range. Now you have taken medication and you have not taken meal. Now the presumption is that you will be taking meal, that is why you need medication. The medication you have already taken, you have not taken meal, so your glucose is not rising. But this medication has a potency to bring down glucose by 30 or 40 milligram per deciliter. So at whatever level the glucose is, this medication will act and push it down by 30 to 40. And that is where the chances of hypoglycemia will come. So if you miss meals, very good chance that your control in any case is going haywire, but chances of hypoglycemia will also increase.
The next important question is, what if I forget to take before meal medication?
So again, if you have there, as I mentioned, some of the new medications you can take just before meal, during the meal, immediately after meal. Those medications you have, forgotten to take with meal, it's fine. You take during the meal when you remember, or immediately take after meal. But best is not to, kind of keep varying the timings. It's always best that you always keep your medication with you when you are going for meal. Now, there are other medications which will cause change. Some medication which is, suppose, starting its action in 45 minutes and peaking, say, at 2 hours. Now you have forgotten before meal and you take it after meal. Now, first thing is you have already missed the meal induced peak. Your medication will start taking effect, say, in 45 minutes, peaking around 1.5 hours. By the time you have already missed the peak of the glucose, that has already happened, and the glucose is already on decline. Now you are likely to push it harder to decline and cause hypoglycemia, right? Or if you have taken, say, suppose people what will do, now I will take half tablet instead of one. You have taken half tablet. It may not have suppressed the glucose level enough to cause hypoglycemia due to previous meal, but during the next meal, its effect is going to be persisting. So it can have a cumulative effect at next meal and again push down glucose level. So timing is very, very important in relation to meals.
So my next question to you is, what if I don't eat my meal till after 40 minutes of medication?
Unlikely to, again, depending on what medication you are on. So if you are you have not taken meal, say 45 minutes, and you have delayed it, chances are that if you have a medication which is potent enough, will push you into a hypoglycemic episode. So it is very important that you have to take medication on time. If you are likely to miss, it is better to prepone. But if you postpone it and you are a well-controlled person with diabetes, chances are you will develop low sugar.
Another very important topic is about the sick days. So, what about the medication in sick days when you are not sure of whether you will be able to eat or not? So, how to manage this situation?
So you should always be, first thing is you should be frequently monitoring your glucose level during all sick days. Second thing is immediately consult your treating physician. There may be a requirement for change of medication or initiate insulin and so on. So always be in touch with your physician and follow the advice. And make sure that you are checking your sugars regularly and keeping under control. That is more important.
Sir, any other tips you would like to give to the audience for this
Uh,
medicine
so
adherence?
there are, new technologies which are coming. So I would refer to that also. We
Okay.
initially, just discussed. So now we are getting more and more, technological advances. And with that, we are getting very, very novel systems of drug delivery. So, and that has made possible, availability of drugs which were as tablets which were are heavy, which have been always in injections, and we are not able to convert them to the oral tab. But now we have been able to use those technologies and do it. Now, this particular medication I'm talking about is oral semaglutide, and which is launched in India by the name Rybelsus almost exactly a month back. So this has a very unique technology. Uh, it can what the pharmacological molecule or the drug is oral semaglutide, which is a GLP-1 receptor agonist, orally active, right? And this, since it is a protein, once you take this tablet, it will be digested like food because it is a protein, and stomach will digest all the proteins. That is why till date we don't have any protein molecule in tablets except this is the first one. So second thing is in the acidic medium, the degradation of protein will happen. So first thing is now they have created a tablet in which there is a covering which protects it in the acidic medium and also facilitates its absorption during through the stomach mucosa. But to maintain that, now you don't should not be having anything that is increasing the acid amount. You should not, and it is very sensitive because it has to go at the stomach lining and get absorbed. So if you have consumed food, again the absorption will be hampered. If you have consumed a lot of water, it will get diluted fast and get digested. If you have consumed less water, it may not be fully absorbed. So you have to follow that. You have to take it as first thing in the morning, and after almost half an hour, don't consume any liquids, any foods, anything, right? And this is important so that the absorption of medication is happening in the desired amount. Otherwise, either you will have the lesser absorption or the more absorption and lead to impaired effect of the drug. So it is very important that this, and you are taking this molecule, this tablet with only half glass of water, and again 30 minutes you don't need to take anything, because if you take something, suppose you take more water, you have defeated the purpose of taking a half glass of water. You have taken food, now this absorption will be hampered. So you have to take it empty stomach with only about 120 ml of water, and don't also not take anything say for 30 to 45 minutes after the tablet. So you will need come with such specific uh, customized kind of delivery things now in future, that we may be using more and more different methodologies in terms of you know uh, increasing the absorption of drug, and also the have the proper effect of the drug.
So you mean to say you have to take the proper tablet at the proper time, need to be organized.
Yes,
So we have few questions from the audience. Can I take?
yes, why not?
So one of our audience, she wants to know about Ryzodeg insulin, the timing in relation to meal.
So Rhizodec has two insulin components. One is the faster acting component and other is the basal component. Now basal, as I mentioned, Tresiba is the basal component here, degludec, and this molecule can be taken at any point of time, irrespective of the meal, right? Now, the faster component has to be taken before meal. So it is to be taken, say, about 10 to 15 minutes before meal, because the faster component is rapid acting insulin. Can be taken just before the meal, it can be taken with the meal also. But best would be to take it, say, within 15 minutes of initiating your meal.
So few days back, I had a query regarding Rizorac. My patient called me up maybe around 8:30 or 9 o'clock. We have forgotten to take the insulin and we are going for a marriage party. So is it possible that when I come back, maybe at 12 o'clock or 1 o'clock, I can take my shot?
No. So basal will not change the effect, but the rapid action is there. And if he has forgotten to take the shot before meal, immediately after meal, fine. A person has taken meal, attended the wedding, come home. We don't know how much gap it is already there after the last meal, right? If it is already 1.5 to 2 hours, it is of no point to add rapid acting there.
So do you suggest these patients should check their sugar levels at that time or they should skip it?
Who patient? Which
These
patient?
patients who have missed their insulin dose and taken their meal.
So best is to not take the dose, take the next dose only if you are taking Rizodac. But if you're on basal, then plus minus 1-2 hours does not matter.
Sir, I'm talking about this Rizodac patient.
Rizodac, if you miss the dose, you can't take it after meal. After a gap, immediately after meal you have taken is fine.
So I mean to ask, this rise in sugar, does it has it should be taken seriously or this level should be avoided when there is an excursion in sugar?
No, one off. See, if it is happening one off, say one thing in a week or 10 days time, is okay. But if it is your habit, then it has to be taken seriously. Yeah. So right. one off sugar value going little haywire is not going to change the overall profile of glucose. But somebody is persistingly above the levels of say 140 and 200, I think we need to change the dose.
So another question is, does it make significant difference in extended release and plain, example, metformin?
So there is a big difference. The metformin effect lasts, the whole dissolution and half-life is about 2 hours and the effect lasts for about 6 hours. And if we give it 3 times daily, it has to be given with meal or before meals, and it causes a lot of gastric upset. With the sustained released or the, whatever different technologies they have used to make it sustained release, it is one, you have convenience of taking the tablet before or after meal, it doesn't matter. Second thing is it gives you effect over 24 hours. And third thing is the gastritis is decreased, right? So sustained release formulations are developed to increase compliance, to reduce the side effects and have better effects of the medication, right? So and second thing is you by increasing the convenience, you are able to improve adherence to therapy. Now, if somebody has to take 3 tablets of metformin, regular acting, just before meal, and is working person, then he has to make sure that he's carrying those tablets. But if you are taking, sustained release metformin, you can give it twice daily, morning, evening, or maybe 2 tablets in one go. And patient doesn't need to remember that he has to take medication during office hours. So these are the advantages that we get with the sustained release, formulations.
So, sir, I'm through with the questions. Do you have any other points to share with the audience, or would you like to say anything more?
I think the timing of, I would just like to conclude is the timing of medication in relation to food is very, very important. And timing of medication in relation to the daytime also is very important, depending on what is suggested by your treating physician. So there'll be some medications which are better given at night. There are some medications which are best taken as morning medication, empty stomach. There are some medications which will be prescribed 30 to 45 minutes before meal, or others maybe just before meal. So they have a relevance why they are being prescribed so, right? So please follow those instructions for the system, and you will definitely have better control of glucose and less risk of hypoglycemia or complications.
So that brings to the end of the session, sir. Thank you.
Thank you. Thank you,
Thank
Dr.
you,
Kirti,
everyone.
and thank you everyone for joining our session.
Thank you.